Good morning and good afternoon, ladies and gentlemen. Good morning and good afternoon, ladies and gentlemen. My name is Qasim Younis. I'm the General Manager for the Victorian Government Trade and Investment Office to the Middle East and Africa region. We're going to start shortly our session, so we're going to wait a couple of minutes to wait for other attendees to log in. Be patient with us, please. Thank you very much. So the Office of the Victorian Government Trade and Investment in the Middle East and Africa is the representative office for the State Government of Victoria and has been established since 1997 to facilitate trade, investment, education between the State of Victoria, Australia, and this region. I would like to thank you for making the time to attend today's webinar, which will be an opportunity to have a close look at Monash University's research activities in the healthcare, medicine, nursing, and health sciences, where our key speakers today will give you insights into Monash University PhD and postdoctoral programs. For those who haven't been to Australia yet, Melbourne, the capital of Victoria, is a house for leading international institutions that are connected globally, where Monash University plays a significant role in Victorian healthcare sector. As you have seen recently, Victoria managed to decline the number of coronavirus cases from 700 cases a day to 0 cases per day. This is the 11th day in a row with 0 new cases and 0 death cases, which is showcase Victoria's healthcare ecosystem as a global benchmark. I'm joined today by my colleague Cindy Callender from the International Education Division, Madeline Sexton and Barish Sattar. Barish is our Senior Education Service Manager who will be moderating this session and introduce our key speakers today, as well as giving you in a moment a snapshot on Victoria's education ecosystem. I wish you enjoy this 1-hour session, and now I will invite Barish to moderate this session. Barish, over to you, please. Thank you.
Thanks very much, Qasim, for this great introduction. Hello and welcome again to today's webinar. As my colleague mentioned, my name is Barish Sattar and I will be moderating this webinar on behalf of the Victorian Government Trade and Investment Office in Dubai. We are delighted to host speakers from Monash University today. Before I begin and talk a little bit about Victorian education as the first speaker, let me first mention a few housekeeping notes for the attendees. Please note, video and audio are not available for session attendees. Please use the Q&A function if you have any questions or technical issues. We will have time at the end of the session for questions and answers. The session is recorded and will be available after the event. We will also make the slide presentations available to all the attendees. Let's start now without further ado. In next few minutes, I will talk to you about state of Victoria in Australia, particularly quality of our education institutions and lifestyle for visitors, researchers, and students. Victoria has the strongest economy of any states in Australia. I say that because despite its size, which is only 3% of Australia's land, Victoria produces 25% of Australia's GDP. Our economy is the best performing economy in Australia, with higher GDP growth than any other state. The size of our economy is bigger than Singapore, Hong Kong, and New Zealand. If you ever visited Victoria, you may remember Victorian car number plates carry a logo says Victoria, the education state. It is because the Victorian government is prioritizing education. And because we are well aware education is fundamental to Victoria's current, future, social, economic, and global success. Next slide, please. Victoria is highly regarded as Australia's knowledge, innovation and intellectual capital. People in Victoria are living in a safe and vibrant environment. Again and again, Melbourne is named among the world's most livable cities. It's in the study done by the Economist Intelligence Unit. The title is awarded to cities with the highest score for stability, healthcare, culture and environment, as well as education and infrastructure. Melbourne is a stylish multicultural city. It's got iconic buildings, it's fantastic coffee culture and delicious cuisine. You will catch Melburnians talking about Melbourne's coffee roasters and baristas and best cafes all the time. We in Melbourne love our coffee. Within a short drive of Melbourne are many of world-class tourist attractions, from natural springs to coastal villages, including the Great Ocean Road. Some of our pictures show that on this slide. In Victoria, there are 21 primary languages spoken. In fact, you'll be interested to know Arabic is the 5th most common language other than English spoken at home. Next slide, please. Thank you. Let's look at the international education in Victoria now. This data you see about international students is slightly old. According to updated figures, Victoria had a record high of 310,000 international student enrollments in 2019. Students coming to Victoria from over 170 countries. It's a fact we're very proud of. Melbourne is ranked as Australia's best student city and 3rd best in the world by QS Best Student Cities ranking. We are only behind London and Tokyo. Another indication Victoria is a premium higher education and research destination is that Victorian universities continue to perform well in the world university rankings. 8 Victorian universities appear in the top 400 in the world, according to Times Higher Education 2020 rankings. So international education is an extremely important fabric of our life in Victoria. Thanks to our universities and strong corporate sector, Victoria is a leader in Australia in medical research and biotechnology. Next slide, please. Well, that's actually my last slide. On this slide, you see a beautiful aerial picture from Melbourne with a number of world-class stadiums, sports grounds and exhibition centers. I wanted to put that picture on because it shows how Melbourne offers a stunning backdrop for world-class major events we deliver each year. Among others, 2 well-known examples of those international events are, you can see it on this slide, the Formula 1 Grand Prix and the Australian Open Tennis Grand Slam, which happens every January. So it comes as a no surprise, sports science and sports medicine is a key field within the health programs offered and delivered at Victorian universities. I will finish off my presentation by saying this. Of course, we live in a COVID world now, but hopefully once a new normal is established in the near future and international travels resume, we look forward to host some of you in Melbourne to get a first-hand experience of what Melbourne and Victoria has got to offer. Now that's it for my presentation. Next, we will hear from Dr. Akram Aspetwa, Clinical Associate Professor at the Department of Radiological Sciences at the Faculty of Allied Health at Kuwait University. He is one of the distinguished alumnus of Monash University. Dr. Akram is currently traveling in the United States, and because of the time difference, he cannot join us live. Instead, he pre-recorded his message and shared with us. We will now play the recording.
Middle East and Gulf, and good afternoon to people in Australia. I would like to thank the Victorian government as well as Monash University for giving me this opportunity to talk to you about a medical research PhD program at Monash. I'm a national as well as international degree of PhD, and I'm currently working as a clinical associate professor at the Department of Radiological Sciences in Faculty of Allied Health Sciences in Kuwait University, and as well as I am an adjunct Monash University in Australia. Briefly, after several years as working as a radiologic technologist in Kuwait public health system, and I did my master's degree in anatomy at Faculty of Medicine at Kuwait University, I became then an accredited medical sonographer with a diploma of medical ultrasound from Australian Institute of Ultrasound in Medicine in 2000. And I developed an interest in emerging field of research in vascular imaging. Due to the lack of literature and expertise in imaging blood vessels, using non-invasive techniques, it motivated me to undertake a PhD at Monash. And I was drawn to undertake a PhD at Monash in April 2001 due to the presence of several high regarded and internationally renowned academics in the field of radiography. I had access to a strong pool of mentors who supported me through my PhD from both the university and its rich network, including Monash Heart. PhD at Monash allowed me to further my academic and research career at Kuwait University. I commenced there in 2002 with my role as a clinical senior lecturer, and now I am a clinical associate professor in the Department of Radiological Sciences in the Faculty of Allied Health at Kuwait University. Completing my PhD has allowed me to combine my passion for academia with that for practicing medical imaging in a clinical environment. My PhD also gave me the tools to become a champion of training and educational activities in radiography as well as ultrasonography at Kuwait University. Monash has furthered my teaching and training skills, which has allowed me to successfully run several training courses for both local and international people. I continue to have a strong collaborative relationship with Monash through my position as an adjunct senior lecturer at the Department of Medical Imaging and Radiation Sciences. I'm now working towards establishing an ultrasound program at Kuwait University. This will teach radiographers and sonographers to perform a variety of sonographic procedures and operate sophisticated ultrasound equipment. I'm working closely with my mentors and colleagues from Monash to roll out this much needed training program, which has been successfully running in Australia, linking counterparts from our Department of Radiologic Sciences at Kuwait University with those at the Monash Department of Medical Imaging and Radiation Sciences will help make this training become a reality and success. Thank you very much. I miss Australia. Very nice country to be there. Thank you very much.
We thank Dr. Akram for sharing his experience and thoughts about his studies and research engagement at Monash University. Our next speaker is Dr. Nizar Forjur. He is the Associate President for the Middle East, North Africa and Central Asia at Monash University. Dr. Nizar is a clinician by training. Nizar holds an MBBS from Ain Shams University in Egypt and a Master of Clinical Family Medicine from Monash University. Before joining Monash in 2006, Dr. Nizar lived in the UAE. He was the Director of Primary Healthcare at Sharjah Medical District for 30 years. From 1976. He supervised the establishment of primary healthcare in the Emirate of Sharjah. Dr. Nizar's primary role at Monash University is developing a country-specific Monash strategy for educational and research involvement in the region, to proactively engage with leading universities and educational institutions, as well as government agencies and industry, and developing senior-level linkages with key government bodies. Dr. Nizar, over to you.
Thank you, Barish. On behalf of Monash University, I would like to take this opportunity to thank the Victorian Government Trade and Investment Office, Middle East, Africa, and Turkey for hosting us at this webinar. I also would like to thank Global Victoria for inspiring global possibilities for all institutions in Victoria. The MENA region seeks to position itself as a global hub for higher education. Monash University has significant engagements in the region with universities and government institutions in projects such as curriculum licensing, capacity building projects, and research. Just to give you an example of our engagement in the region, in 2013, we worked with Imam Abdurrahman bin Faisal University, formerly known as the Dammam University at the Kingdom of Saudi Arabia, to lift the quality of their medical curriculum to international standards and licensed our medical curriculum through working together on modernizing and developing of the medical curriculum at IAU. In 2018, we continued offering IAU benchmarking, faculty professional development, and student mobility programs. Next slide, please. Another example, we worked with the Ministry of Health and Prevention in the UAE in developing the National Health Research Strategy. This was a combined effort towards developing a world-class health research ecosystem in the UAE. There are so many examples, but I would like to mention briefly a couple of them. The National Trauma Institute at the Alfred Hospital and the Department of Epidemiology and Preventive Medicine at Monash University is working with King Saud Medical City and the Saudi Arabian Ministry of Health in the establishment of a trauma registry for the Kingdom of Saudi Arabia. The Victorian government, in partnership with Monash Health and Monash University, is building Australia's first heart hospital, which is named as the Victorian Heart Hospital. It will be built at Monash University Clayton campus and is due to be completed in 2022. So Monash University and Monash Health will be partners in providing education and training for cardiac care to health professionals from the MENA region at all levels. Another example of what we are doing is the Monash Children's Hospital, which is part of Monash Health, and it is one of Australia's leading providers of integrated children health services, with more than 30 specialist services and programs. This is just a summary of what we are doing with the Middle East, North Africa, and what we can offer. Thank you very much for having us. It's a pleasure to talk to you. Back to you, Barish.
Thank you, Dr. Nizar. Before I mention our last speaker, a reminder that we will have time for questions and answers at the end of the presentation. And we will also make the slides available after the briefing. Please use the Q&A box to post your questions as we go. Now, I am delighted to present you our main speaker today, Professor Nelly Georgiou Christianis. the Deputy Dean, Academic and Graduate Affairs in the Faculty of Medicine, Nursing and Health Sciences at Monash. Professor Christianis is the Deputy Dean, Academic and Graduate Affairs within the Faculty of Medicine, Nursing and Health Sciences. In this role, she supports the Dean and the heads of school to lead the strategic academic planning, as well as the excellence in graduate research training. Nelly is also Professor of Psychology. She is internationally renowned for her pioneering work in rare neurodegenerative disorders, such as Huntington disease and Friedreich's ataxia, where she has discovered novel biomarkers of disease progression. Her discoveries are currently being used in clinical trials globally. Now, I would like to hand over to Professor Christianis for her presentation and insights. Thank you, and over to you, Nelly.
Thank you, Barish, and welcome everyone. It's an absolute great pleasure to be part of this webinar, and I'd firstly like to thank the Victorian Government Trade and Investment Office to the Middle East and Africa for organising this special event and providing us at Monash with the opportunity to showcase the PhD programs available within the Faculty of Medicine, Nursing and Health Science. I'd like to begin my presentation with a very short video about Melbourne, and we heard from Barish about Melbourne, because if you come to Monash University, Melbourne will be your city for the duration of your studies. And there is lots to offer here in Melbourne as the world's second most livable city. Thank you.
Walk around through the streets of your town. No, I won't be late. Let my pride wash away with the tide on a warm summer day. I free myself from the past. Want you to stay. I'll say there's no looking back, 'cause I won't be late. Walk around through the streets of your town. No, I won't be late. Let my pride wash away with the tide on a warm summer day. I free myself from the past for you.
Thank you. Next slide. Monash University is the largest university across Australia and is also a global university with a presence on 4 continents. Now, despite the COVID-19 pandemic, Monash has very ambitious plans on how we will leverage opportunities to accelerate our efforts for the future. Next slide. Monash University has over 80,000 students from over 160 countries. Half of those students are domestic students and the other half are international students, with a number of students who commence their studies offshore. We have a staggering 17,000 plus staff, which consist of both academic and professional staff. And we have over 400,000 alumni as part of our global community. Next slide, please. Monash University is a top 100 university. As you can see, we rank in the top 100 across all the most common university ranking measures, such as the QS academic rankings of world universities, otherwise known as the AWAR, as well as the Times Higher Education. Specifically, the Faculty of Medicine, Nursing and Health Sciences ranks in the top 50 across most of its disciplines. And you can see there in nursing, medicine, pharmacy, public health, and so forth. Next slide. Monash has among the highest research revenues of any Australian university. And in fact, last year, the research revenue for Monash was a staggering $400 million. The university invests significantly in research infrastructure, platforms, education, and so forth, and we've invested in total over $1 billion on research. Next slide. The Faculty of Medicine, Nursing and Health Sciences is one of 10 faculties across the university. We're a research-intensive faculty and we focus quite heavily on improving human health, improving the well-being of our communities by significantly advancing knowledge of humankind and focusing on educating the brightest minds, our practitioners and researchers. Monash University was #1 in Australia for publicly funded competitive grants in medical research last year. We have over 1,500 PhD students, and many of those students, over 75–80%, are successfully completing their PhDs on time and within 4 years, full-time candidature, with a staggering 87% of student satisfaction with the overall PhD program from surveys that we've undertaken in the last few years. Next slide. With respect to our faculty's research areas or research topics, we have a number of key research areas of strength. These areas of strength align with national and international priorities, and we use specialised platform technologies so that our research remains relevant, it remains modern, and it remains cutting edge. Some of these research areas of strength, as you can see on this slide, include cancer and blood diseases, very active research in cancer, in development, stem cells and regenerative medicine, in metabolism and obesity, in cardiovascular disease, and you heard from Dr. Nazar that Monash is building Australia's first heart hospital in collaboration with the Victorian government, which will be a landmark facility to host and train the next generation of scholars. We have key strengths in infection, inflammation and immunity. And in fact, Monash has had over 30 experts advising our state and federal government on COVID-19 and is at the forefront of COVID-19 response with significant research projects on vaccines and treatment strategies to prevent death. We have key areas of strength in public health, critical care, trauma, neurosciences, mental health, and in fact we're leading Australia in understanding the impact of COVID-19 on mental health, especially in adolescents and young adults, as well as strengths in women's, children and reproductive health. Next slide, please. I now would like to shift the topic slightly to introduce the PhD program within our faculty with a short video. Thank you. Shall we try the video one more time? If not, we can move on. That's fine. Okay, so the video really will showcase a lot of what I'm going to talk about now. So you can watch the video in your own time, not a problem. So this next slide is about the PhD, and often we get asked, how can we get into the Monash PhD or the doctoral program at Monash? What are the different pathways and what do we need to do? So this slide, as you can see, there's a number of circles. The pink circle in the middle is the Monash PhD program. And the blue circles highlight the different pathways of entry. So you can enter the PhD program with a 4-year bachelor degree with a research component in a relevant area, or you may enter the PhD with relevant research experience and outputs such as peer-reviewed publications. You might have a medical degree or a degree in health sciences or equivalent. You may enter with a master's by research degree, or you might have a master's by coursework with a research component. So you can see there are a number of different pathways of entry. If, however, you don't meet the entry requirements for the Monash PhD, you may like to consider the Monash Graduate Diploma in Health and Science Research, which you can see there in the orange circle. This is a 1-year program with a research thesis, and it offers a direct pathway into the Monash PhD. And there's more information there on the website if you would like further information on this graduate diploma. Next slide, please. Now, if we can talk a little bit more about the PhD program at Monash University. A PhD at Monash is a 4-year program of study, a full-time, or 8 years part-time. The PhD requires you to work on a research topic that you're leading, that you're innovating, under the supervision of at least 2 supervisors. And your supervisors will supervise your research throughout the course of your study, and at the end of the 4th year full-time program, you will submit an 80,000-word thesis for examination. Now, because we believe that the PhD is more than just a research thesis, we have developed 3 PhD programs that give you extra skills and increase your employability opportunities. And I'm going to talk about each of these 3 programs, and depending on your background, on your interest, you can select a program, a PhD program that suits your interests. Each of the 3 programs that I will talk about now do require you to work on a research topic under the supervision of supervisors, but they're just different in the focus that we give. Next slide, please. The first PhD program that I would like to introduce to you is the Translational Research PhD program. This program is a coursework program. So every semester there are a number of units that you're required to undertake. But during this program, you will learn how to translate your research, the research that you might be doing in the lab. You'll learn the relevance and the translation of that research into clinical practice so it has community benefit. And this is why we call this program the Translational Research Program. When we're undertaking health research, even in the grants that as academics we submit, we're judged on how our research can translate into the community to make real impact and make important human benefits. You'll learn from our clinical research experts. You'll access data sources and research platforms. You'll be located within leading hospitals that lead medical innovation and undertake cutting-edge clinical trials. We've got a significant number of clinical trials at the Alfred, at Monash Health, on Parkinson's, Alzheimer's, multiple sclerosis, many clinical trials. You will learn how to translate your research into the design and development of drugs, drug compounds, as well as medical devices. You'll learn how to run clinical trials, how to patent and commercialise your research through engagement with industry, and this program also provides industry placements. Next slide, please. The second PhD program I would like to introduce you to is what's called the Public Health PhD program. This is also a coursework program which requires you to undertake certain units in each semester. But when we talk about public health, and it's so relevant if we look at the pandemic and what's going on around the world globally, public health research focuses on factors that can influence health, such as genetic factors, environmental factors, social factors. And some of the research projects include things like how to prevent disease, how do disease outbreak, how do diseases spread in our community, how can we prevent injury. So they're big public health topics that we really need to understand. During the program, you will gain epidemiology and biostatistics skills, which will help you design and conduct public health research. You will also learn and understand the social, cultural and economic determinants of health. And you will also gain skills and confidence to communicate the scientific knowledge that you gain to the public, which is so important in terms of how to communicate to the public. And how can we influence, or how can you influence translation of your work, your research into policy, government policy, clinical practice and guidelines that are going to make an impact to the health and betterment of our community. Next slide, please. The third PhD program that I'd like to introduce, and this is the last program that I'll talk about, is what we call the Professional Development PhD program. Now, this program is not a coursework program, but rather this program offers you the opportunity to select different types of modules or training modules that you can do online, mostly online now because of the pandemic, to suit your interests. And you can select different training modules across 8 different key competencies. And you can see these competencies on this wheel in different colours. We have competencies including entrepreneurship, collaboration, communication, leadership, and so forth. So we have developed and designed specific modules, training modules, under each of these competencies that you can do throughout the course of your PhD, so that you can upskill with the prime aim of getting you work ready so that you can enter a range of careers of your choice in either academia, government, or industry. Next slide, please. Other types of skill development training activities that we offer include how to create a LinkedIn profile. We offer alumni events, career speed networking, which is really important. So we invite alumni that are working in our community to talk to our students so they gain experience through this opportunity. We have a suite of library courses to upskill you in writing for science and communication, how to write the thesis, publication writing, all based on upskilling and training you for the future. We have a very specialised PhD student mentoring program where we can match you with early career researchers within our faculty so you can learn from them and they can guide you throughout the course of your studies. And we also offer training on how to improve your CV and how to equip you with interview skills that will enable your success for the future. Next slide, please. We also have a number of support services that we offer our PhD students throughout their studies. I mentioned English language support, which is really important. We provide this through our library, academic and conversational programs, grammar, pronunciation, as well as a suite of online resources that you can access. We have other areas where we focus on written and communication skills, support groups, writing groups, one-on-one consultation, intensive writing courses, as well as upskilling you in how to give oral or conference presentations, which is so important throughout your studies, as well as an opportunity to learn how to access publication databases so you can search for critical research, those really important research articles, so you can incorporate them in the understanding of your research so that you remain relevant. We also offer a series of workshops and training in health and well-being through mindfulness, stress management, mentoring, as well as counselling services. So there are many support opportunities that Monash University provides you throughout the course of your candidature. Next slide, please. The other unique offering that Monash provides to help support you through your studies is the progression management support pipeline. We have a number of progress hurdles throughout the course of your studies to ensure that you are remaining on track with your studies, and if there are any issues, we can intervene to help sort those. Because we believe that by doing this, we can help you progress and help you submit a quality thesis within the 4-year timeline. We have a 6-month progression framework. We have a 1-year confirmation milestone. We have a 2nd-year progress review, as well as a 3rd-year final review. And these reviews allow you to talk to a panel, to showcase in an oral presentation your project, and you can receive feedback from the panel to further enhance your research. Next slide, please. Now, we have a web page, obviously, where you can find out more about what our researchers are doing, what our research capabilities are. You can find out more from our PhD students, learn about their research topics. There's a number of success stories, and you can find out a lot more about the degrees that I've just mentioned today. Next slide, please. We're very proud of our alumni from the Gulf region, and we have a few examples of some high-profile alumni that have graduated with a PhD from our faculty, and I'd like to just introduce these to you briefly. We have here Dr. Ala Otier, who finished his PhD in 2017. He is now an Assistant Dean and Assistant Professor in the Faculty of Applied Medical Sciences at Jordan University of Science and Technology. Next slide. We have Dr. Wadi Alonazi, who completed his PhD in 2013. He is currently an Associate Professor and Chairperson, Health and Administration Department at King Saud University in Saudi Arabia. Next slide, please. We have Dr. Akram Mahmoud Al Abd, Azbatar, who completed in 2006, and we heard from him previously. He's an associate professor in the Department of Radiologic Sciences in the Faculty of Allied Health Sciences at Kuwait University in Kuwait. Next slide, please. And we have Dr. Abbas Al-Mutair, who completed in 2014, and he's currently an assistant professor and director of the Research Centre and chairman of IRB at Dr. Soliman Al-Habib Medical Group in Saudi Arabia. So we're very proud of these alumni. Next slide, please. The PhD students at the Faculty of Medicine, Nursing and Health Sciences, of the 1,500 PhD students that I mentioned that we have enrolled, 30% of these are international students, and they come from over 60 countries globally. And here we just have an example of students from Indonesia. We have a student here who's doing a PhD in nursing. We have a student who's from Germany undertaking a translational PhD project, a student from China who's undertaking a project in bioinformatics, a student from the US who's undertaking a project in obstetrics, and one here from Sri Lanka who is undertaking their PhD program in general practice. And this is just a showcase of many students that come from all over the globe. Next slide, please. So we're now at the end of my presentation, and I'd like to just go through a number of slides if you're interested in applying, and we'd love to hear from you on how is it that you apply. So many of you here, I mean, this is a topic that comes up, and I'd like to go through this step by step. So the first step is to secure your scholarship. We do give priority to interested applicants who have secured a government-funded scholarship from a relevant agency, or they might be self-funded. So that's the first step, to ensure that funding is available to undertake a PhD at Monash. The second step is to submit an expression of interest. So interested applicants that are on this call should submit an expression of interest, which is a live link on our web page. And here we are gathering information about your academic background, about your research interests. And what we will do is we will provide a specialised service to this cohort of interested students, and our team will review your expression of interest for eligibility into the program and will communicate with you throughout this process. Next slide, please. Once we determine your eligibility, the third step is helping you find a PhD supervisor and our research project. So our team will work very closely with you, as I mentioned, providing you with a personalised service to match you with a supervisor that's working in your chosen area. So if you're interested in cancer, in blood disease, in Parkinson's, or in infection, we know who those supervisors are, and we will match you to those supervisors based on your chosen research area. And this is really important because we've got almost 2,000 academic research staff in our faculty. So by providing you this service, we believe it will help accelerate this process for you. And the fourth and final step is, once you start communicating with a potential supervisor, and when both you and the supervisor and the project have been confirmed, and this can take a little bit of time by email or maybe by setting up some Zoom interviews so you can get to know your supervisor and further understand the project. Once this has been confirmed, the next step is that Monash will provide you with an invitation to apply. and then you may complete your full online application. Now, we will help you along the way. We will help process your application and will support you through this process, recognising that we're still in the middle of the COVID-19 pandemic and many of the borders are closed, but we will work with you in the meantime to help assess your application, match you with a supervisor and go through that process very carefully to make sure that you have all the information you require, so when the borders are open, it will be a smooth transition forward. Next slide, please. Now, if you require any further information on any of the content that I have spoken about today, or maybe even after the webinar, you might have a question that hasn't been answered, please do email us using that email address there. Please also visit our web pages. As Barish mentioned, these slides will be made available, so if you haven't written down the link, don't worry, you'll have this available to you in the PowerPoint presentation. Please make contact with us. We'd love to hear from you, and we would love to stay engaged with you throughout this whole process. So that brings me to the end of my official slide presentation. Now, I'm not sure whether we've had any questions in the question and answer chat box, but my colleague Cassandra has collated these questions and she will read out the question and I will provide an answer. But as I said, if you have any other questions that haven't been dealt with, please do feel free to engage with us via email. So Cassandra, over to you. Do you have any questions for me?
Thank you, Nellie. The question we have raised is what is the English language requirement?
Thank you, Cass. That's a really important question for our international students. So the university requires documented evidence in support of English language proficiency with its application. Now, the English language proficiency can be satisfied in one of three ways, and I'll go through each of those now. The first way that it can be satisfied is through language of instruction. And what we mean by language of instruction is an applicant who may have successfully completed a course of tertiary studies of at least 2 years duration. It could be an undergraduate degree or it could be a master's degree, but it must be entirely taught and formally assessed in English as part of a Monash approved English language country, and you can find more details about that on the Monash webpage. So that's the first pathway, I guess, to satisfy the English proficiency. If, however, an international student doesn't satisfy that requirement, the second opportunity is to undertake an English language test. And the English language test must be completed within 2 years of your application. And the most common type of English tests, as I'm sure most of you here will know, are the IELTS academic test, as well as the TOEFL test. Now, these are both available online because of the COVID-19 pandemic. Students can't access the English language centres face-to-face, so you do have the opportunity of undertaking these tests online. Now, with respect to the IELTS test, many of you may know that the score for Monash, the overall band score to meet the English language requirement, is a score of 6.5 overall on the IELTS test. And with regard to the TOEFL test, the requirement is a score of 79 plus. So that's the answer to that. And the third pathway with respect to meeting English language proficiency is some students may wish to undertake an English bridging program. And Monash does provide an English bridging program. Applicants may complete this program and details are available on our webpage. And we also offer, for anyone interested, a packaged offer, which means an English bridging program plus PhD as a package. Thank you, Cass. Any other questions?
Yes, Nellie, there's one other question, and that is, how do I find a project, or how do I find areas of research?
Thanks, Cass. Another really important question. I think it's really important for any interested students in studying within the Faculty of Medicine, Nursing and Health Sciences to have a good look at our web pages. We have a lot of information on our research capabilities and research strengths. Another very important platform that interested students may like to look at is what we call Supervisor Connect. On Supervisor Connect, our research academics to post research projects that are available to prospective students. So you can browse Supervisor Connect for a research project that might suit your interest and to look at the types of projects that we offer. We do, however, we would love, however, for interested students to complete the expression of interest first so that we can go through that process so then we can individually match you. However, by looking at our web pages and by looking at Supervisor Connect, you can get a feel of the type of projects that we have on offer to suit your needs. We also have on our website all the 9 research areas of strength that I mentioned throughout the presentation, so you can have a look in more detail about the leading innovations in those areas. Thank you, Cass. Any other questions?
No, there are no other questions.
All right, thank you, Cass. I'd just like to take this opportunity to thank you all again for listening to the presentation. It was my great pleasure. I'm very humbled for you taking the time to be part of this webinar. As I mentioned, we're here to support you with any questions. If you decide you would like to proceed with an application, we will support you every step of the way throughout this pandemic, keep you engaged up until our borders are open. So that brings me to the end of my presentation. Thank you again. And I'd like to now hand over to Barish.
Many thanks, Professor, for your presentation today. And thank you, Cassandra, for your assistance with the Q&A. We had people registered for today's webinar from UAE, Kuwait, Saudi Arabia, Australia, and people from as far as Kazakhstan. So in closing, on behalf of the Victorian government, as well as the panelists, I want to say thanks very much to all the attendees for making the time to join us at our webinar. Hopefully you have found the information and the discussion useful. I also would like to sincerely thank all of our presenters today for their time and contribution, as well as my colleagues Qasim Yunus, Cindy Callender, Madeline Sexton, and Mireya Creels for their support and assistance. The session is recorded and will be available to all the attendees, along with the slides and contact details of the presenters. today. Please do not hesitate to reach out to any of us for questions or comments. Stay safe and well. Thanks again, and bye for now.